Hi, my name is Helena. I'm going to show you SIRT planning. What we have loaded is the MAA spec CT. That's what we can see in this top view. And we also have an external CT, a diagnostic CT that was taken previously. The application has automatically registered the SPECT with that external CT. So first I'm going to start off with drawing some regions. I'm going to use this view for that. We have a really great automatic algorithm that can do liver, kidneys, lungs and spleen. I'll just choose liver for this one, but if you have the whole lung field of view in the SPECT, then you can choose the lungs as well. While it's working on that, I will draw some other regions. So I'm going to use this single click segmentation tool. This sets a threshold on the nuclear medicine. I'm going to take that down a little bit. You can see a preview of what you're going to get, and then maybe that's a bit high. Let's make a click there just to take that region, and then maybe do a few more. Let's have this bit here and this bit here. So that's one way of drawing regions. You can also use the paintbrush tool to manually define regions as you like. I'm going to just toggle the fusion off of this view so that we can see only the CT. And you can click and drag the paintbrush tool to define whatever size you like, whatever region you like. With this tool, you can start outside to take away, inside to add, and then the application will interpolate that region to subsequent slices. You can see the outline of the liver has appeared there in the background. The algorithm has finished. Got a few regions that we can use for tumours in this demonstration. So once you're happy with the region drawing, we can go back to the previous stage. And now we can start populating this SIRT planning table. We have a choice of treatment planning radionuclide. You can see we have yttrium-90 or holmium-166 available. I'm going to choose yttrium-90 for this treatment. We can type in here a value for the planar lung shunt. So this has been calculated externally. Let's say that we've got 5% for this patient. You can see here that if you did have the whole lung field of view in the SPECT, the application would calculate for you a 3D lung shunt. Total count from. So this shows you how the application is going to do the patient relative calibration factor. So in choosing this, it will say, it basically assumes that all counts that you're going to inject, all activity is going to go into the liver, with a little bit going into the lungs according to the planar lung shunt. Now we can select our regions. So the liver region, that's what I'll choose here. And you'll see we have an option here. We can do activity region as well. It's set by default as same as volume. But if that's not very good, so we can see, if we just window the nuclear medicine all the way down, let's get a bit more range on this colour bar, and we can see, is that well fitted to that liver region? And actually it does come outside a little bit, so maybe it's worth drawing another region there, and then the application will use the volume from this region and the activity from this region in the dose calculation. In this way you can correct for perhaps patient motion or any kind of spill out of counts from the liver region. So I'm just going to use a really low threshold there to get all of that activity. Okay, that looks good. Let's just rename this one liver activity, and we can choose that here. The lung calculation, so that's done. If you don't have a lung region, that's done assuming a lung mass of 1,000 grams. You can change that in the settings. Now we can choose, if you wanted a separate perfused liver region, you can define that and draw it. For this treatment, we're just going to perfuse the entire liver, so you can populate this one here. Now we can add some target lesions, so we defined 3 of them, and now you can just choose them. 1, 2, and 3. And you'll see that the application has calculated automatically a healthy liver region, also a healthy perfused liver. Of course, that's the same thing in this case. So we can see what 1 gigabecquerel of yttrium-90 would give us for the dose. Perhaps these tumour doses are not quite as high as we'd like, so let's just adjust that up, and you can see you get this live feedback of what the dose will be with a bit more activity. But of course we've got to be careful that we're not going too high on the healthy liver and lung doses, so we can keep an eye on that up here as well. You'll see that there's an option here to add activity injection. So in this way you can actually do 2 separated injections into separate perfused volumes to optimize your patient treatment, if that's a better way to plan. Okay, so once you are happy with your plan, we can write a comment if you like, and then we can save reports and also the regions. So I'm going to hit this button here, Save SIRT Planning Report. Okay, the application is now saving a DICOM encapsulated PDF of that, all this information, any screenshots that you might have taken during the planning, and also the regions are saved as DICOM seg files so that you can reload them later to help with the verification. Here's what the planning report looks like, and then all the information in the table as well is written out here. Any screenshots that you'd included would be put on the end of this report too. So what we've got loaded is the data from the SPECT CT planning. So here we have the technetium MAA and the CT with the regions that we've reloaded from the plan, and they have been automatically co-registered and copied across to the post-therapy scan. In this case, it's a post-therapy yttrium-90 PET, but we can also load a Brem-Strahlung SPECT if that's what you've got. So you can see the regions are copied, but perhaps they don't fit quite perfectly. So the first thing I'm going to do is hit this button, Fit Regions. What this does is apply a deformable registration so that those regions should be fitted nicely onto the new CT. So it's using the CT information to work out the right way to deform the region to fit on the verification scan. So now we can see we've got verification versions of each of these regions. All the information about the administration time and date of the yttrium-90 microspheres has been copied in from the DICOM header. We can type in here if we need to exactly how much we put in. So let's say we can see what was planned was the 2.3 gigabecquerels. Let's say that we only managed to get 2.2 into the patient. Now we're using the patient relative conversion method. So this amount of activity is assumed to have gone into the perfused liver region, and then that is how the doses are calculated. So the therapy dose is in this column here. The planned dose, that's what we planned in the previous stage, is copied in here, and the dose difference is displayed in this column here. We can, if we want to, so because we do have an yttrium-90 PET scan, we can use the quantitative information in that image to do the calculation instead. So rather than use the patient relative method, we can use the scanner calibration factor if we trust that more. So you can just check and uncheck that to see the impact on the doses. There's other things that we can do if we think that these regions are still not quite right. Even after the deformation, it's possible to edit those. Once you're happy with your regions, we can write any comments as needed and then save a report. So I'll click this button here to save the SIRT verification report. So we can see the report contains the patient's information both from the planning study and from the verification, the settings used for the dose calculation, and then the information from the SIRT verification table is shown here. And then any screenshots that you've taken would be appended onto the end of this. That was a short demonstration of the SIRT verification workflow in the Hermia software.